Good afternoon, my name is Hope Frost, and on behalf of SBK Healthcare, I'm delighted to welcome you to this patient experience of flash glucose monitoring webinar. Thank you for joining us this afternoon. I would like to thank Abbott for kindly sponsoring this webinar and making it possible. If you enjoy today's webinar, please make sure that you subscribe to our YouTube channel and like the video so that you see more of the content that we upload. So it is now my pleasure to introduce Professor Ramzi Ajan, who is Professor of Metabolic Medicine at the University of Leeds. And he will be joined by Laura Yates, who's a person with type 1 diabetes, and she will be sharing her story with you. So thank you, and it's over to you, Ramzi and Laura.
Hi, I'm Laura Yates, and I have been living with type 1 diabetes since I was 13 years old. I was diagnosed in November 2008, so I've been living with diabetes for almost 13 years. I started using the Freestyle Libre technology around a year ago, and I've since become a Freestyle Libre brand ambassador because I'm such a big fan of the flash technology. I'm using multiple daily injections with the hope of being able to transfer onto an insulin pump soon.
Thank you very much, Laura. I'm Ramzi Ajan. I'm a professor of metabolic medicine, and I look after people with diabetes. So I practice diabetes clinically. I look after people with diabetes, particularly younger people with diabetes. My first question is, how did you feel when you were first told you have type 1 diabetes?
Absolutely terrified, in all honesty. As I said, I was only 13 and I didn't really know what diabetes was or what it involved. So to be told that I would have to live with type 1 diabetes for the rest of my life and it was incurable, it was a massive shock and very overwhelming. And it did take me quite a while to get to terms with it and to understand it. And I'm still learning all the time, even 13 years down the line.
So if I can pick one thing, Laura, what was sort of the most frightening aspect of it?
Definitely the needles. I was terrified of needles. I didn't like any of the kind of the routine immunizations that I'd had as a child. So to then be told that I'd have to inject myself several times a day, it was a massive thing to get my head around, as I said, and I was absolutely frightened about it.
Of course. And of course, test your glucose as well, isn't it?
Absolutely, more needles.
Yeah. So just moving on from the diagnosis, let's talk about the few weeks to months. What were the difficult aspects then when you started adapting to it?
Yeah, luckily I was only actually an inpatient in hospital for one night, and then I was discharged the following day to go home with my family. And I did have then support from the specialist diabetes nurse, as well as the consultant at the hospital, the dietitian, who I have to say were incredibly helpful and really did help me to come to terms with it. I suppose one of the most difficult things for me was trying to readjust to normal life after having a few days off school, then going back to school and trying to kind of work out how diabetes would fit into my normal life as I knew it before the diagnosis. That was something that was really difficult, and trying to explain it to my friends as well. At just 13 years old, I didn't really understand it all quite yet, and to try and explain to my friends that all of a sudden I couldn't do what I'd done at lunchtime normally. I had to go to the school nurse and have my injections, because at that point I wasn't doing my injections myself. I had to have some help from the school nurse. And explain, what to do if I did have a hypo, and what it meant, and how I might act a little bit differently to how they knew me. That was a big challenge, absolutely.
And can I ask you, were you worried about telling your friends, and how did they react when you told them?
I would say I was worried about telling them, because partly I hadn't quite come to terms with it all myself yet. It was a massive shock. And I didn't want to be telling them the wrong information whilst I was still learning. I also didn't want people to look at me any differently. You know, I wanted to still take part in everything that I'd done beforehand. I'd always been a very kind of active child and teenager, and I loved playing netball at school, and I still wanted to do all of those things. And I didn't want my friends to think of me differently or think that I wouldn't be able to kind of join in as I had done before. And so I suppose, yeah, as a teenager growing up and you're still kind of finding your way in the world, that was definitely a concern for me. And I wanted to do everything that I had done previously and that my friends were doing.
I mean, that's such an important point, and I'm so glad that you raised it, actually, because, you know, I hear it a lot from my patients that we want to be exactly the same, and there's absolutely no reason why not. So I think that's an important point. Now, something that is important to me, Laura, as a healthcare professional,
Mm-hmm.
is the support that you received, not only early on, but later. Do you think that was adequate? Is there anything that can be done to make it better? Or do you think it was absolutely perfect? So I would really like to, and please be brutally honest with this, because as I say, it's very important to me as a healthcare professional.
Yeah, I will be. So as I said before, when I was in hospital, I did find the support was brilliant. I think going on from that in kind of the weeks, months down the line, I would have appreciated more support in school especially. And I don't know if this is something that's changed over the past kind of 13 years since I was in the situation, but having more support to, for example, my school nurse, who wasn't a specialist in diabetes, to help her understand how to support me, I think I would have found very useful, because obviously I was having the opportunity to catch up with the specialist diabetes team when I went in for my routine checkups, but day to day it was the school nurse who was the medical support that I had kind of most day-to-day contact with. So I think if she perhaps had been a bit more clued up and had more support there, I think that would have been really useful.
Okay, so that's at the school days. And then what about when you were going through the transition from, you know, the pediatric services to the young adult services? What do you think of the support then?
I would say it was very helpful in terms of the support that I had there from the medical professionals. One thing which I think could be improved is more opportunities to get together with other people with type 1, particularly of the same age and going through the same kind of changes, and, you know, that transition from the pediatric to the adult services, and also things like going away to uni and all those things that you're doing for the first time at that point in life. And I did find that wasn't really available. Now, perhaps that's just something that wasn't available in my area. But I think kind of the pediatrics, they had their own support network. There was a group for kids with diabetes that ranged from, you know, toddlers right up to 11 years of age. But actually, as teenagers, there wasn't so much there for kind of peer-to-peer support, which I think I would have found really valuable.
So that's very interesting. So you identified more support to the nursing school, you identify this peer-to-peer support, which I would definitely take on board. And what about support when you're moving to the adult services? And I'm going to ask you a very specific question here. Do you think it's important to have the same people that you can deal with, rather than having sort of too many people, rather than having a team to have a person or persons for that matter, but not a very broad team to deal with? What are your views on that?
Yes, I would say that having the same people that you're in touch with and you have the support with, it would be beneficial, because I think it does take a while to build up a relationship with somebody, and to kind of get the most out of that contact, you do have to be incredibly open and willing to kind of admit where you're struggling or you are having difficulties, and have the confidence and the trust in the person that you're talking to, that you know they have your best interest in mind, and they completely understand kind of your life as a whole and how diabetes fits into that. So I think definitely building up that rapport with the same person, it is helpful to have that kind of consistently through that transition time.
So that sentence that you said is really interesting, actually, Laura. They understand my life as a whole. I think this is really important. And one thing that my patients tell me, that they don't want to repeat the same story again and again. They want somebody they know. So it's really important. Okay. Moving on, you mentioned that you were diagnosed in 2008, if I remember correctly. And you mentioned all the difficulties initially. What would you say is still difficult after more than a decade of diabetes? One aspect that you still find very difficult?
Oh, it's hard to name just one. I think diabetes is always a challenge. There are no kind of, there's nothing that stays the same, because you have so many different variables that you have no control over that will all impact on your sugar levels. So things like the weather, your hormones, exercise, food. I mean, I wouldn't want to eat this exactly the same meals every day for 13 years. So I think to have kind of a fulfilling life and live life as I want to live it, there will be constant kind of calculations and trying to work out how much insulin I need, and try and kind of counteract everything else that's changing in my life. Just when you think you've got it kind of nailed, there'll be something that doesn't work quite as you planned or you expected it to work out. Kind of, you can keep giving consistent doses and then your sugar levels won't behave as you want them to. So there is always something to try and tackle, I would say. But definitely kind of recognizing that there will always be something else. You can't just think, oh, I've got it nailed now. There will always be another thing, but everybody has that. And I think it's really important to recognize that everybody faces those struggles.
So if I completely appreciate what you're saying, that there are multiple factors, but if I can summarize it in one word, would you say sort of sometimes the uncertainty that, you do exactly the same as you've done on a Tuesday and Wednesday is different? Is that a difficult aspect?
Yes, definitely. Yeah. I would say that is the most difficult. Yeah.
Yeah. No, I completely understand that. Now, Laura, I'm a great believer, if I'm going to ask my patients to do something, I need to try it out myself. So I tried in the past insulin injection, well, not insulin, it was saline injections. And I tested my glucose regularly with the capillary glucose testing, stabbing my fingers. So, and I formed my own view about it. But I wanted to hear from you, what do you find more difficult, having the insulin injections or doing capillary glucose checks?
Oh, that's a good question. I would say probably doing the tests, just because I think it takes slightly longer in terms of, say you're out and about, you have to find somewhere to wash your hands and kind of get out the meter, get out your strips. Then which is best practice, you document the results and kind of document everything that's going on. So when you last ate, what exercise you've done. I think that can be a little bit more time consuming. But on the other hand, I suppose it does take a little bit of time to do the injections as well. By the time you've worked out your carb counting, your dosage rate, I'd say probably the testing. I'd say that is more of an inconvenience.
Well, I can tell you, I personally found the testing more difficult, and I was going through the motions of, calculating carbs and everything else, and I certainly found the testing more difficult, and a lot of people tell me the same. Now, my understanding is that you've been using the Libre device to check your glucose. Since when? When did you start using it?
It was just over a year ago, so spring 2020.
Right. And did this make a difference to the management of diabetes? Did it make things easier or more difficult? If you just give us an idea.
Yeah, definitely. I'd say it really, really made it a lot easier to monitor my glucose levels and manage them accordingly. Because as I just said, it was an inconvenience to me to test my sugar levels by using the capillary testing. And I live on a farm, so I'm always out and about on the farm, and especially at really busy times of the year, it was an inconvenience to have to come indoors and sit down and get my tester out and making sure I was doing it properly. So to just have then a little sensor on my arm that I could scan my phone with, it's so much quicker and easier to see what my glucose levels are doing, and not only get a snapshot of what they're doing at that point in time, but be able to see if they're going up or down, and kind of a rough idea of what they've been doing all day, kind of average levels, time, the percentage of time spent within the targets, and identify patterns and address that accordingly. So absolutely, it's made a massive change to my diabetes management in a very positive way.
So I think you said something that is really very interesting, that I'm not interested only in a snapshot because I want to look at patterns. And that is such an important point, isn't it? Because that's one beauty about the device, that you can see patterns because it records so many glucose readings that you understand what's happening with the diabetes. Any drawbacks, any difficulties with it?
I would say, well, I suppose one thing that kind of put me off trying it initially was, would it be uncomfortable to firstly insert and then to wear it for 2 weeks, because you wear the sensor for 2 weeks before changing it. And also I was a little bit hesitant about having something so visible kind of on my arm. But I have to say I was very pleasantly surprised that it was completely painless applying it for the first time. I have very, very little discomfort, if ever. And I'm actually quite proud to show it off, to show my sensor and have that mark of, I battle diabetes every day, and it's something to be proud of. So I would say I've come over those drawbacks quite quickly.
I must say, you summarized everything that I hear about the sensor. Really? This is brilliant. And I tried the sensor myself. And the most difficult aspect for me was taking it off, because it did stick really hard.
Yeah.
Which I guess is a good thing.
Yeah.
Right. So one thing I want to have your views on, and this could be a slightly unfair question, actually, but I'm still going to ask it, Laura. Okay. I'm sorry. So I hear a lot that the Libre, the sensor, increases the consultation time with the patient. So it eats into the consultation. And, healthcare professionals got limited time. Do you think that is true? I mean, I've got my own views on that, but I wanted to hear it from you. What do you think as somebody at the receiving end of that consultation?
I wouldn't say that it has increased my consultation time. I think, if anything, it's made it more efficient, because using the LibreLink app, my diabetes specialist nurse or consultant can actually see virtually my results, and they can actually look at those in advance of my meeting, my appointment, so that when I get there, they're already aware of what my glucose levels have been doing. And I think actually they can see so much more quickly the averages and the patterns, as I mentioned before. So I would say it's more efficient, actually. I don't think in my personal experience it has eaten up into the consultation time, no.
I mean, I honestly can't believe this, because I have no idea what your answers will be. I mean, we haven't practiced this, so I didn't know what you're going to say. And you use the word efficient, and that is exactly my views,
Oh,
actually.
really?
That it makes the consultation far more efficient
Mm.
when you have all the data. And I mean, one thing that I see a lot is that people start telling me, now we understand what's going on with the diabetes. And the moment people understand what's going on, then implementing treatment changes is far more difficult. It's far easier
Yeah,
than
yeah,
people not understanding what's going on.
definitely. I mean,
So
for
I
example, when
I'm in full agreement with you on that.
oh,
Efficient
good, we're on the
is it,
same page. I mean, for example,
absolutely.
when I was younger, and I would be writing down all my results in a little book. Firstly, it relied on me actually writing them down, and then to put in write down the information, like what I ate, what exercise I was doing, any other changes. I then got to kind of look through manually and see whether there were any patterns or anything that was happening day after day, kind of the same routine. And then I had to remember to take the book to the appointment, which didn't always happen. So definitely, I think that you have so much more visibility over your levels, and that is really, really
Yeah.
helpful.
And remember, you have 96 readings a day, which is impossible to do with the capillary glucose testing. So I think it gives you really a global picture of what's going on with the glucose levels.
Yeah.
Excellent. Right. Now, it's very exciting times with diabetes, because a lot of new things are happening. And to me, that's, it's music to my ears, that I always tell my patients that life will get easier
Yeah.
for people with diabetes. And we're already seeing that things are easier compared to how they were 10 years ago.
Yeah.
So from your point of view, Laura, what advances would you like to see in the management of type 1 diabetes? What can make your life even easier?
I suppose on a personal level, I'm looking forward to hopefully getting an insulin pump, which I think will make life a lot easier, by having that technology and not having to do the multiple injections every day. Something that in the past I've been quite hesitant to try, as I would say that I've generally had pretty good glucose management with the multiple injections. So kind of if it's not broken, why fix it? But actually trying the glucose, flash monitoring technology, the Libre, has definitely made me realize that technology has such a big impact to add. It can be so beneficial, and you never know unless you try with something new. So I'm definitely up for trying the insulin pump. I think on a wider level, one day I would hope to see pancreas transplants becoming mainstream and more accessible. I know that there are some initial trials going on, and it has been proven to work, but I think, yeah, it might be a few decades down the line, but I do have hope that that will be a possibility one day.
And may I ask you, why were you reluctant to use a pump before?
I suppose I was just hesitant to try something new. I worried that it would kind of disrupt my management of my type 1 diabetes that I'd taken years to kind of get under control and get my head around, and felt very kind of confident and comfortable with doing those injections. So I was reluctant to kind of rock the boat. But as I've seen with the Libre, sometimes you need to do that and you don't realize what you're missing out on.
So there are two types of treatment that I would want to ask you about, see your views. So one is immunotherapy at the diagnosis of diabetes. So at the diagnosis of type 1, there are trials where you give some immunosuppressants to suppress the reaction and prevent those cells that produce insulin from dying. What are your views about that approach? Because there are more sort of studies ongoing in that area.
I think that's really interesting. I haven't heard too much about that, to be honest, but I think if it is being proven to make life easier for people who have just been diagnosed with type 1 diabetes, then it has the potential to have massive benefits. And we'll be really intrigued to hear kind of how that goes and whether it's successful. I think diagnosis is such a tricky time that perhaps people may be reluctant to try something that hasn't been quite rolled out completely yet. So I think personally, I wouldn't want to try something that had only been kind of pioneered on a small scale. But as I say, you've got to keep trying new things to move technology forwards.
No, absolutely. I completely see your point. Now, the other thing you may argue, yeah, but that only applies to people with newly diagnosed. What about people who had diabetes for a while? So for people who had diabetes for a while, what are your views about the closed loop? So you have got your pump, you've got a sensor, the two are communicating to each other, and they are managing the diabetes. What are your views on that?
I think it's brilliant, yeah, and it shows just how vital technology changes are, because that's something that's only been a possibility within recent years. And it does take all of that kind of mental toll and the calculations of your insulin ratios and your blood sugar management, it takes all that burden away from you, and the closed loop works that out for itself. So I think that has the potential to have a massive benefit to people with diabetes, and it's something that I would definitely be keen to try.
Yeah, I would like to stress that I think it will happen. We already have closed loops. I think we will be using them at a wider scale. But I think people shouldn't feel that this will completely take over. They still need to have that input into their diabetes.
Yeah.
But I think it will make a difference in the next 5 to 10 years. Right. Now, a question about COVID. Do you think COVID made the management of diabetes more difficult?
Yes, I would say it probably did on reflection, because the face-to-face appointments were replaced by virtual kind of phone calls. I don't know if some people had video calls, but myself, I just had phone calls, which, although it was still useful, I would say I probably got more out of the face-to-face meetings with the diabetes specialist team. So it did make that element of management trickier. I think also it was a stressful time for people with underlying health conditions, because obviously we're at greater risk of complications due to COVID. So it was a worrying time, and I think the impact of isolation and kind of loneliness and not having that social contact will definitely impacted so many people. Obviously not just people with diabetes, but I think you face such a big challenge day to day, and kind of without that social context, it's much more difficult.
I think you very elegantly summarized all the issues with COVID, and I was really glad to hear this issue of face-to-face, because I mean, from my point of view as a healthcare professional, it's been an absolute disaster not to see my patients. Yeah. I hate it. I really hate it, because there are a lot of things you can't pick up over the phone. You can't even pick up on video consultation. We do both video consultation and phone calls. And the most important bit from my point of view is that when I ask my patients, do you want a face-to-face or a video or a telephone? The vast majority say face-to-face.
Yeah.
So that's what I need to do. And to me, I'm absolutely delighted by that. But I did not expect to have the vast majority wanting face-to-face. So I think we can get a lot more out of a face-to-face consultation. I completely
Yeah, I
agree.
agree. I agree. It's really
Again, I
interesting
agree
to
with
hear
you,
your
Laura,
perspective
again.
on that. Yeah.
Right. So I think we're sort of coming to the end, and I have one question left for you here. I would like you to give general advice in relation to managing diabetes, but I would like you to divide the advice to patient advice and healthcare professional advice. So what would you say when it comes to general advice to patients and healthcare professionals?
I think to patients, I know I've already kind of touched on this, but to patients, definitely recognize that diabetes is a challenge. And although it might feel like some days are a huge struggle and nothing's working as it should, and you've done so many of the same things over and over, but you don't get the same results, and diabetes does throw a spanner in the works, to remember that everybody with diabetes has those days, even people who you think have got their management completely under control. It's not the case, and everybody's in the same boats, and it's okay to reach out when you have those days. There will always be somebody willing to listen and to give you advice on how to improve things. So definitely don't be afraid to open up, reach out, and recognize that you're not alone. I would say for healthcare professionals, try and understand how diabetes fits into your patients' lives. Although it's great that people know so much about their diabetes control of their patients, I think diabetes is such a small part of who I am, for example. I think there's such a bigger picture that needs to be considered when it comes to diabetes management, and how the control and the monitoring of our glucose levels fits into that. Because I'm absolutely adamant that diabetes doesn't control me, and I want to live my life kind of with good management, but not let it stop me from doing anything.
Well, thank you very much. I mean, this last bit that you said, that diabetes doesn't control me, that's what I keep telling my patients, that what we're going to do is not diabetes controlling you, but you controlling diabetes. And I think it's such a simple but really important message. So there are a few things that you said, and I'm going to pick on the advice to patients, which was open up and reach out. And I think that is such a good advice. Don't be afraid of telling your healthcare professional what you want and what you need. And as for the healthcare professional, I can summarize what is needed by one word: understand. And that's what you said. So I think that's really a very, very good summary. Laura, to be honest with you, I can talk to you all day. This was really very helpful from my point of view as a healthcare professional, and I hope everybody else found this useful. Thank you very much again, and I think we need to stop now. Thanks.
Thank you, Ramsey.
Just going back to the very beginning, when you said, I would have liked to have additional support, and you explained sort of partially what that additional support is. But if I can just pressure you a little bit more and say, what additional support would you have needed very early on in the first year, and then in sort of 3 to 5 years and long term? Just if you divide it for us.
Yeah, I think to start with, I think I would have appreciated more support at school, because the hospital team were very good, but then that was just such a small part of my life, and school was such a big part of my life. And I found it very difficult to, I suppose, communicate all the ins and outs of diabetes. So perhaps if there was more medical professional support within schools to help teachers and other children understand what diabetes is and how it might affect somebody, I think that would have been really, really useful in the early days. And then I suppose as I was growing up, perhaps I think more peer peer-to-peer even support would have been very, very helpful. To speak to other teenagers that were going through the same things in the same boat and could, I suppose, a bit more on my level than the medical professionals, although I know they're the experts, but to speak to somebody that's in the same boat and going through the same things at the same kind of stage of life would have been helpful, I think.
Right, Laura. So that follows on from the second question that came in, which was, do you think that teenagers would be happy to have this peer-to-peer support or these groups to discuss things? The majority of teenagers would be happy with that. What are your views?
Perhaps not. I think it might be a bit unrealistic to think that every single teenager would be forthcoming and being very honest with how they were struggling and get together. It might not necessarily be top of their priority list, but I think we have to try and give people those support systems and those networks if they do want to use them, and then encourage them and kind of show them what they can get out of it. Because I think maybe I was quite reluctant to talk about my diabetes, but actually if I'd have had that option there, there's never been a time where I've regretted talking about my diabetes. I've always been glad and I've got something out of it, and it's always been worthwhile. So I would definitely encourage anyone going through the same things at that age to join a network and talk about it more.
So what you're saying is that people should have the choice to do that.
Yeah.
And do you think that healthcare professionals should be present in these group meetings, or at least pop in for a short while and then leave people to it? How do you envisage that working?
Yeah, I think perhaps, like you said, popping in would be good. I think perhaps you might get a bit more open and honest conversation if there's not a medical member of staff there the whole time, because you're always conscious of who's listening and what you'll admit to and how actually open and honest you will be. I suppose you might think in the back of your mind, oh, I'm going to get told off if I say the truth or how I've actually been doing things. And I think it's probably more useful if it is just other people your age, but maybe you have the option at the end of the session to speak to the medical professional, one of the diabetes team.
Yeah. So before continuing with the question, there are two comments that I would like to cover. One person said that the pediatric services are now offered greater level of support, and I think we need to fight to have the adult services, particularly the young adult services, having the same level of support, because at least where I work, the pediatric services have got 4 to 5 the level of support, financial support I'm talking about, that we do in the adult services. The second comment was about people not wanting to see different healthcare professionals, that they complain about it. And there was actually a suggestion many years ago in our center that we would just share all the patients. And I just sent an email back saying OMDB. And for those of you who don't know what that means, that's over my dead body. So it never happened. I mean, I'm a very flexible person, but there are things because I know how the patients think. So it didn't happen, and I'm very glad that it didn't happen.
Yeah, I agree. I think because it does take time to build up a relationship and get to that completely open two-way dialogue, and you are, I don't want to say admit to what you've done wrong, but you are completely honest about how you've been finding things, and you have that confidence and trust in somebody that you will give them the full picture, and it does take time to build that up. So I think it is more valuable to stay with the same individual that you built a rapport with over time. Definitely, I agree with that.
So the next question comes from a dietitian who's very interested in how you cope with the constant carb counting and changes.
Well, funnily enough, I'm actually starting a Daphne course this week, which I'm very excited about. So the dose adjustment for normal eating with the diabetes team, which is something that I wanted to do for a while, but with work, it hasn't quite fitted in, and going abroad. But really looking forward to that, because I think carb counting for me is something that I've always really tried to do, and I have had a lot of support with from the dietitian team. I used to have the Carbs and Cals little book when I was first diagnosed, and I then downloaded an app. But it's something that I think will be really useful to get together with others and kind of be on the same journey together, and really dedicate some time to learning how to do it properly, and measuring my food, and knowing exactly kind of portion sizes, and how that relates to insulin calculations. Because I would say the majority of time I would make a good guesstimate in terms of carb calculations, and I do tend to eat the same things, but to be able to know exactly my insulin to carb ratios for different times of the day, I think that'd be super useful, and would give me more confidence, I think, as well, when I'm going out and about and eating out, and eating kind of food outside of home. I think it'd make life a lot easier.
So I've got two questions about Libre. One is about the accuracy of Libre. Do you find it as accurate as the finger blood testing?
Yeah, I do, definitely. There might be occasions where if your blood sugars are falling or rising very rapidly, where because there's a 15-minute lag in the timing that your sensor registers the glucose. I think that's correct. Don't quote me, but I'm pretty sure it's 15 minutes. You may need to do a blood sugar test, or sometimes if I think, oh, I don't feel high, but my Libre is saying I am high, or perhaps I feel hypo, but my Libre is not telling me that, I will just double check. And I'm very confident in the accuracy of the Libre system.
So can I add
I wouldn't
to that,
use
Laura?
it if I didn't think it was telling me the right things.
Laura, can I just add that with the newest sensors, they've got a new algorithm, and actually the lag has been cut down drastically.
Oh,
So
really?
it's 2 to 5 minutes now, so the lag
wow.
is much shorter. The other thing for people that need to understand that the finger prick testing is not 100% reliable. And some of the cheap ones are very inaccurate, actually. You know, we measure accuracy by something called MARD, mean average relative difference. And the MARD for the Libre is around 9%. And there were some very cheap, so the lower the better. There were some very cheap finger prick testing strips where the MARD was 25%, which is ridiculous.
Wow.
So I think it depends what you're comparing it to, and of course the lag, as you quite rightly said.
And like I said, the inconvenience as well. Like I wouldn't say that I in the past always wash my hands thoroughly, or did the whole routine exactly as it should be done in best practice. So I think the convenience of the Libre for me is the most brilliant thing about it.
So the second Libre question is, do you use Libre 2?
Yes, I do. Yeah, with the alarms.
And how do you find the alarms? How do you
Very
use
helpful.
them?
Very helpful, because the flash technology, is brilliant as it is, you do have to think to scan. So perhaps if you don't always I'd say I'm pretty good with sensing when I'm going high or low, but you don't always know. So to have those alarms as a warning, I find really, really helpful, and it's then prevents me going mega high, mega low, and does help me to keep much more stable glucose levels overall.
So the next question is really important. What are your views about the level of psychological support needed for type 1 diabetes? So that's one part of the question, and there's another part to it. But if we address the first part first.
I think it's very important, psychological support in the whole aspect of diabetes management, because it's a big burden that you have to think about. There's not one part of life, I don't think, that diabetes doesn't affect, and it's something, I know I said in the film that I don't like to let diabetes control me, but you do have to think about it all the time, and it would be very irresponsible just to forget it or pretend it doesn't exist. That's no good for anybody. So it is something that's always on my mind, but over time it has got a lot more easier to manage with the help of technology, obviously. But I think you definitely need support sometimes to realise that you shouldn't feel guilty if you do have a bad day, or not everybody's perfect at managing their levels. People will always have up and down days, and sometimes you get to a day you think, oh, I've why isn't this working? I've done the same thing that I always do and it normally works, but not today. And it's so frustrating sometimes. But to have that support there, somebody you can talk to and will help you to see kind of the reality that it won't always be easy. And somebody there that can provide you with practical advice and support as well, and tips on how to manage the emotional burden, because obviously your levels going high or low, that does affect your mood and emotions as well, which obviously interplays with your relationships. So definitely I think psychological support is very, very important.
So let me tell you, I fought really hard to have psychology support for our young adult clinic, and it transformed the clinic. It's been incredibly helpful.
Oh, really?
What was also very helpful, which was suggested by my pediatric colleagues, and I wasn't too sure about it initially, is to have a youth worker. So the youth worker at sort of at the lower level, if there are some difficulties, can talk to this person. And people who are struggling a little bit more, then they get psychology input. And that has made things so much better. So if you can have a youth worker and a psychology support in your clinic, that would be really good.
Yeah, that's really interesting to hear.
Yeah, the second part of the question, Laura, was, does technology help with the psychological aspects, or can it make it more complicated or more difficult? And I think it's a very fair question, actually.
I think I wouldn't say it makes it more complicated, in my opinion. I think from my experience, it's made my glucose management more simple because I find it more convenient and easier to test my levels. I think it could perhaps be overwhelming because of the amount of information that you do have access to and the data you can get. I think it has the potential to be overwhelming, but that's where the importance of your support team comes in, and you can talk it through and make sure that you're looking at the right numbers and you're looking at the most important things, which are the biggest priorities for you, and kind of pinpoint it down to target any changes you need to make. I think the other aspect of technology, which I would really like to mention, is the impact of the internet and social media, because for me, since I suppose sharing my experience of diabetes and connecting with other people with type 1 via social media has had a massive positive impact on my life, and helped me to kind of see that I'm not the only one, because I live in quite a rural area. There aren't that many people my age, especially with type 1 diabetes. So it really, really helps to have that forum to share experiences and share things that work for us as well.
So I think from a healthcare professional point of view, technology can be useful to reduce the stress, provided, and this is really, really important, provided it is introduced in a step-by-step approach and there is enough education attached to it. So technology on its own will not solve anything. It has to be linked to proper education, and do not overwhelm the patient. That is something that you don't want to do. So the next question, I absolutely love it. It's a brilliant. You can call it cheeky, but it's a brilliant question. What are some of the most helpful suggestions that you received from your diabetes team, and the less helpful suggestions that you received? So in terms of good and bad suggestions.
I was encouraged to reach out to other people at school with type 1 diabetes, which, as I say before, the importance of having that support network and peer-to-peer advice and sharing, I think that was very, very important for me. In terms of not so helpful advice, that's a tricky one. I'm trying to remember. I think you have to be realistic with the advice that you give, especially a teenager, because I think the expectation that you're going to write down every single glucose level and you're going to stick to a very strict routine and you're going to write down every injection you have and write down what food you eat, I think it's ambitious. And like I say, I just wanted to live a normal teenage life and do everything that my friends were doing, and I didn't want to live my life by a book where I had to write everything down. So I think to try and be realistic in what you're asking teenagers to do, especially when they're trying to cope with the emotional side of diabetes as well and living with a chronic disease, and have realistic expectations of what you're asking for.
Yeah, I think there are realistic expectations. You summarize it by that, because what I really hate when somebody tells me that, oh, we've told Jack to do this and that and hasn't done it. I say, okay, what did you tell Jack? And then you get this list of 20 different things. There's no way anybody can cope with 20 different things at one go. And that's why I always say, one step at a time. Let's tackle this. Let's tackle your nighttime high course first, and then we'll look at the rest of, one thing at a time. And that works. Once you start asking people things that are just not achievable, because nobody can do it, tackle 20 different things at one go, then this is where you lose the patients. So there was a very specific question for you, Laura. Would you recommend Libre a diagnosis?
Definitely, yes. And it's something that I wish I had had when I was diagnosed, because the visibility you get of your glucose levels, and I think you described it as understanding the full picture and understanding how diabetes works, rather than just the snapshot you get when you prick your finger. That would have helped me so much from the start, to know exactly what my sugar levels were doing throughout the day and nights, and just to have that full picture. Really, I wish I'd had it earlier.
Questions are still coming in, and I love that. So the next one is really good. Is about, what advice would you give a child or young person who's worried about telling their peers at school that they have diabetes, they've just been diagnosed?
I would say, well, from my experience, it won't be as bad as you think it's going to be. And nobody, although people seem normal, there's no such thing as normal. Everybody is different. Everybody has got their own things going on. And you probably don't even know what somebody else is dealing with. But that's why I think it's so important to be, and it's hard to be the first one that's brave and says, this is what I'm dealing with, and this is what I have to do. But once somebody speaks up, I think other people will admire you for doing that, and it's something you don't have control over. So I think it's very, very important to have that confidence to speak up, and it's something that does develop over time as you get your head around the diagnosis and how it will affect your life. But I think it's not as bad as it's going to be, and you will be okay.
Right. So the next one is we've got time for 2 questions. So the next one about practical tips. I love this question, actually. Practical tips for healthcare professionals. How can they express compassionate attitude towards people living with diabetes during the consultation? What do you think they should do?
I think the two-way dialogue is really important, and we spoke a lot about understanding how your patient's diabetes fits into the rest of their life, because it is only one aspect. It's quite a big aspect, but it's just one part of their overall life. And I suppose asking questions to understand what their daily routine's like, and that's something that I found very useful when I was diagnosed, and ongoing as well, to understand how any changes that I made would impact on other areas of my life. So to get that conversation going and just get a full picture as much as you can of what goes on day to day in your patient's life.
So two questions. One I'll answer very quickly, and then the other one I'll pass on to you. One question was about the Libre not alarming despite hypoglycemia. Must have been a faulty sensor, something to contact the company about. But the question to you, Laura, is do you use the time in range function very much? If so, do you find it more relevant than A1C?
Yes, so that's the percentage, isn't it, of time in range?
Correct.
Yes, definitely. I'm not saying that everybody should do this, but I try to aim for 75% time in range day to day. Some days I don't hit that. Some days I will get to 90% and celebrate that. But definitely, yeah, it's something that I will look to as a bit of an overall picture of how well I've managed my glucose levels that day. Yeah, I find it very useful.
So is it more relevant than A1C, than HbA1c in your view?
Yes, I think personally, yes, I think it probably is, because you have access to it so much more easily and so much more often as well.
And it gives you more information. I mean, personally, I think it's complementary. I don't think HbA1c is dead. I think it's complementary, but it gives you more information. So I think we really need to stop here. And I think the audience have been absolutely fantastic with very good questions. And thank you very much,
thank
Laura.
You so much for being so engaged.
And
really
I
enjoyed
should
it.
also thank SBK for excellent organization, and of course, Abbott for funding this webinar. And back to Hope.
Thank you very much. Thank you so much, Laura, for sharing your story, and for Ramsey for bringing an excellent host. It's been a brilliant session, and I hope that you have all enjoyed it